I've been in practice here in South Florida in Plantation for 11 years. Very much a family practice. We see all ages of people, all kinds of conditions. Over the years, I've had the pleasure of seeing the typical chiropractic miracle cases and some more challenging cases that up until this point I haven't had the ability to take care of to the fullest extent that I was comfortable with. So I was looking for something to bring to my practice that would enable me to expand my scope, see more people that I can help in a better way. They bring their x-rays to me, they bring their MRIs to me. And upon looking at those films, we can determine whether or not we think that patient is a good candidate for SpineMed decompression therapy. A lot of times some of the patients are a little nervous because it's new, they haven't heard much about it. So we have some materials that they could learn, they can ask questions, they can get to understand the concept of actually non-medically or no medication and non-surgically actually bring some of the healing to the discs that so far they've been unable to heal. So after the patient understands, they get these full explanations and they see the table, everything starts to click. It starts to make sense to them. That with the ability to create this negative pressure in the disc, we can bring in some of the healing fluids from the adjacent bones and discs. Now we can actually start to reverse some of the process. As the patient lies down on the table for the first time, immediately there's no nervousness because there's no discomfort. They've already been put through injections and epidurals and physical therapy that can sometimes be very painful. And quite frankly, some of the chiropractic care they've been through, they've tried every different chiropractic technique and sometimes has to no avail, hasn't really been successful for them. So the table's comfortable, they understand it, it makes perfect sense anatomically, and once they get that feeling from that first time, they understand the protocol they're going to go through. They're going to go through a period of the SpineMed decompression therapy, they're going to go through a period of chiropractic care, they're going to go through a period of rehabilitation, and then more importantly, I believe, is the follow-up of having them change some of their lifestyle habits to what caused some of their problems to begin with. And that's, I think, the combination of what's giving us long-term results of, once they go through the care, helping them for a long period of time so the symptoms don't just return 6 months or a year from now. They make the proper lifestyle changes and they continue to maintain the corrections that we've made. And that's so far what's given us amazing results in the long term.
I was taken into the emergency room and I was given an anti-inflammatory and a painkiller. Basically told to follow up with my MD on Monday. Went to the MD who referred me to a orthopedic surgeon. Didn't want to go that route, so I called Dr. Markson and came in for treatment here. It was also sent out for an MRI. At that point was diagnosed with a herniated disc. Dr. Markson told me about SpineMed and that it was a conservative route of treatment, non-invasive, that he's seen great results from other patients. And I thought that it would be a great way for me to try. I was planning a vacation in 2 weeks, and I thought, let me try and see what I can do. Short, conservative, and see what the results would be. On Monday, when I came in with the pain and the discomfort, I got on the table thinking, what am I going to feel like when I get off this table? And it was remarkable. I was able to get off the table without any discomfort, without any pain. Tuesday was feeling even better. By Wednesday, it was remarkable. Absolutely no pain at all. Totally pain-free. When I came into Dr. Markson for the consultation history, I told him I had a planned trip to go to Europe in 2 weeks' time and wanted to know what the possibilities of me going to Europe. And started the treatment on Monday, and like I said, by Wednesday, plans were full in place. Went to vacation in Europe 2 weeks later, walked 5 to 7 miles a day, never even remembered my back pain, totally pain-free.
When we do our initial consultation and history with a patient, they bring their x-rays or MRIs if they don't previously have any diagnostic studies. I have a great relationship with a local diagnostic imaging company that will do MRIs for us. We'll only accept the cases that we know we're going to get great results. If there's any kind of doubt of whether or not we're going to get good results, you could start to see the patterns, and obviously we're expecting favorable results, or we won't start with that patient at this time. So when a patient comes in, for instance, if it's a low back herniated disc, they have radiation down their legs, they can't function, they can't stand, they can't sit, and now we're going through a protocol of care. Depending on how severe the problem's been there, the age of the patient, the lifestyle of the patient, what they do for a living, there's a bunch of criteria on the patient's lifestyle will give us a specific kind of care plan. How many visits they need on the SpineMed, what kind of concurrent physical therapy modalities, rehabilitative modalities, what to tell the patient to do or not do at home, the chiropractic care and their adjustment styles that fit into the SpineMed decompression therapy. So there's a protocol to the whole thing. We're not just doing the table for a couple of visits and saying, okay, you're fixed, see you later. It's a question of starting with SpineMed decompression therapy as the mainstay of this patient's care, bringing in chiropractic care, physical therapy modalities, and rehabilitation with the appropriate lifestyle changes individually catered to the specific patient's condition.
Immediately after my accident in January of 2005, I immediately felt the pain radiating across the back of my neck, across my shoulder blades in the back. And also what ends up happening from the herniation, I can actually feel the numbness and tingling starting from my elbows all the way to my fingertips. So in the morning when I'd wake up, I'd actually just have to squeeze my hands like this to try and get some of the sensation back into my hands. When I was advised by my orthopedic surgeon that I was a candidate for cervical surgery, I realized that it was not a route that I wanted to go. Because I know it's an invasive route. I would rather try something more conservative just due to my age, and I know that once I have the surgery, I'm going to get a bunch of more problems, that it's not going to end my, my pain and my discomfort further on down the road. When I was speaking with Dr. Markson, I was telling him about my continuing pain and discomfort in the cervical area. He was telling me about this new therapy called SpineMed decompression therapy, and of a new technology that resulted in it and how it actually gets rid of a herniation in both the cervical and lumbar area. Knowing my medical history and how long I've known him, he thought I'd be a good candidate for such treatment. As a result, I started the treatment. I completed the treatment. Literally, was probably after the first or second session of doing it, I actually could feel back the range of motion in my neck, both to the left and to the right. The discomfort that I had that radiated across my shoulders previously was no longer present. I was very amazed on how quickly it actually worked just after only simply 2 treatments. I could feel it actually working. I completed the regimen, I think it was about 24 treatments, and now my range of motion is probably 95% to where it was prior to my motor vehicle accident. And the pain is gone. I wake up pain-free in the mornings. I have no problem sleeping at night. I don't toss and turn anymore. And it's just truly an amazing technology.
One of the things that drew me to SpineMed decompression therapy is the cervical module, their ability to help people with bulging and herniated discs in the neck and the cervical spine. Previously undone before. The people that had these kind of problems were really hopeless because the surgeries that they would have to perform are really invasive and sometimes ineffective. Most of the surgeons wouldn't even do it. So now we have an ability with the same kind of concept of angling the neck part of the cervical part of the table, same kind of restraint on the cervical spine, very comfortable. The patient just lies back. There's a gentle strap across the forehead. There's no head harnesses or anything like that. In that individual angle, isolating the disc that we're able to create. And also the cervical part, the neck part just lengthens gently. It's totally comfortable. The patient still falls asleep. 30 minutes later, they can hardly believe it. And as we start to go through, depending on the patient, depending on what they need in terms of number of treatments, we're getting just such phenomenal results that the results really do speak for themselves. If you're a patient and you come into my office, or someone I met on the street, and I had heard the history, I would recommend SpineMed decompression therapy for a lot of different conditions. For the most part, when I meet people, or if you were a patient, I would say to you, you've been through what you've been told are your only options. You've been through therapy, you've been to chiropractors, you've been to orthopedic surgeons, neurosurgeons, you've had epidurals, you've had all the diagnostic tests, and there is hope for you that you may not know about. And the answer is going to be on a SpineMed decompression therapy table. So come in, come and look at the table. Come and ask questions. Once you lie down, once you look at the table, once you look at the technology, it's going to speak for itself. I think once you have a new hope, you'll see that the quality of life that you've been missing can be returned to you in a relatively simple and short amount of time.